Hi, everybody. Thanks for having me. I insisted when I agreed to do this that I got to go first, because when you hear the other speakers this afternoon, I'm clearly an opening act. So, and I have to talk about science after lunch, so I know that's a little rough. So I wanted to start by talking a little bit about why I did what I did in medicine. So I started out as a regular family doctor, and I spent most of my time as a family doctor teaching in residency programs. So I was teaching other people how to become family doctors. And something became apparent to me. It took about 10 years, but it became apparent. And that was that there was something wrong and missing from our regular medical system. It's a great system to be in if you have a heart attack, if you have a stroke, if you need a surgery, if you have a bad infection. We're super good at acute problems, but we do a bad job at prevention and treatment of chronic illnesses. And one day I was sitting there, and one of the jobs when you're teaching residents is you sit in a little area and 3 or 4 residents are seeing patients, and they come back and report to you and tell what they think is going on, and you're giving them advice. And I would see patient after patient in their 60s on 13 medications. You know, they might be diabetic. If you have diabetes, it's almost like you automatically need 4 drugs. And then one of those might be a medicine for your cholesterol. And maybe that medicine for your cholesterol might cause you to have muscle aches. And now you might have to take an anti-inflammatory medicine for your muscle aches. And now that bothers your stomach, so now you have to take an acid blocker for your stomach. And so I thought to myself, and then when you ask that person, well, first of all, you have 10 minutes to talk to that person about all of those things. And when you ask them how they feel, it's not good. And I realized I had no tools to help that person be the most vital and healthy that they could, and that everything that was masquerading as prevention in medicine was really early detection of things that had already progressed to diagnoses and illness. So I decided to leave, and my plan was to open a bookstore. I was an English major in college, and I thought, this is what I love to do. I love to read. I love to talk to people about books. Well, this was 2007, and the e-book industry and e-readers hadn't quite taken off, so it was very wise that I didn't open that bookstore. Instead, I tried to find a way to do medicine in a different way. So I chose something less stressful and decided to open my own business. So one of the things that I do now, of course, our practice is called the Hormone Center, and we focus on hormones in the body. And the reason I chose to focus on hormones in the body is because all of the body systems are interconnected. So one of the problems in the way we approach medicine in the United States is that we have so many specialists and subspecialists that focus on one system. So we end up having you have to go to the cardiologist for your heart, and the neurologist for your brain issues, and the pulmonologist for your asthma or chronic lung disease, and few of them take into account all of the other systems in the body. I chose to focus on hormones because most of the patients that I see don't have the type of hormone disorders that an endocrinologist or a hormone doctor would focus on. And the reason why is because in medicine, we're trained to only deal with if you look at a bell-shaped curve, we only deal with the 2.5% of people at the top falling out of the range and at the bottom. And if you're in that middle somewhere, there's no help for you. You just have to go on until you fall into one of those categories, till you have the diagnosis, till you have the illness. So as we look at the interconnectedness of this body system, and I've been trying to get this picture off of there for a long time, because especially after lunch, you don't want to really see this guy, but but it's still here. So all of these organs in the body are part of our body. The hormones are chemical messengers. So they take information from our brain and they translate it to glands, which produce hormones in the body, which then every cell in the body has a receptor for every hormone. And those hormones go into the cells and turn on and off certain protein production, and therefore the various functionalities of the cell. So my practice is what I call integrative medicine, where we are trying to use the best from our typical medical system, but also using a lot of science and physiology about how the body works and how it's connected to help prevent illness. So a week in the life of most people. So a week in the life of most people. We deal with financial issues, we deal with our kids, our spouses, our significant others, we have work. And so, there's a lot going on in this day and age. Now, you compound that and you have the week in the life of a business owner. So there's all the same financial stress, relationship stress, home chores, shopping, kids activities, but now you add the stresses that a business owner also faces, of which I would call number one, cash flow. And usually if that's good, most other things are bearable. When cash flow is bad, everything else becomes more unbearable. But there are exit strategies. There's, the marketing, there's competitors, there's risks to your industry. So in addition to all of those regular things that people are dealing with, we have these extras. So my talk is about stress and how that affects business owners differently. Physiologically, it doesn't affect us differently. It's just that there's more of it. So when we look at this curve, so stress was first coined as a term back in 1936. There was a Hungarian-Canadian endocrinologist, his name was Hans Selye, and he first described the stress response. At the time, they didn't know what hormones were involved. They didn't know how it happened. They just knew that if you look at performance on a y-axis and stress or pressure on the x-axis, if you don't have enough stress in your life, you're bored. Productivity goes down because you don't have the motivation. Did you ever have a day where you had one thing to do and you can't get it done because you don't have enough stress or pressure to have that happen? I think the last time that happened to me was when I was 10. But in any case, as that pressure builds, you have a time of what we call eustress. And eustress is good. This eustress drives our performance up. And this is where we have maximum focus, creativity, motivation, and you're just like cranking things out. You're in the zone. But it's a very fine line to when you cross over that peak into exhaustion. And these stressors can be good or bad. Going on vacation is a stressor. It's a good stressor, but it's a stressor. You're punished when you come home. But that once you hit that exhaustion phase, we start to see both there and burnout, we start to see symptoms. So there are symptoms in the body that are associated with stress. All of these symptoms are what we in medicine call non-specific symptoms, meaning, it's not the chest pain that points to a heart attack. It's not like we see one of these symptoms and we think, that's the adrenal glands. They can all be caused by many, many things. So often fatigue can be a symptom of that. You're starting to feel that you can't handle things. I call it the mountain out of the molehill syndrome. Something that might have been very simple for you to deal with in the past now becomes almost overwhelming and intolerable. People can gain weight, particularly around the middle. There's many reasons for that, but stress can be one. Brain, when the brain isn't clear, some people describe it as foggy thinking, some confusion, lack of ability to focus. And so you can see some of the symptoms that we see with stress. I want to talk a little bit about why we get those symptoms and how the stress response happens in the body. And my point of this is twofold today. Number one, I want to convince you that stress isn't just this foofy, fluffy thing that we got to manage stress, I want to convince you that it actually can be life-threatening and it's critical to your health to get this under control. And then the second thing I'm going to do is give you some ways to do that. And unfortunately, there's nothing fancy or scientific or even requiring a prescription to do that. It just takes time and focus. So the stress response system starts in the brain. We have a control center in the brain. It's called the hypothalamus. And it sits in the middle of the brain. It's maybe this big. And it controls not just hormone release, but everything in the body. So it controls your body temperature. It controls your pulse, your blood pressure. And so it sends signals to another gland in the brain called the pituitary gland. That sits at the base of the brain. And that's the master hormone that's going to send signals out to all of your other glands to tell them what to do. So then the pituitary gland is going to signal to the adrenal glands, and the adrenal glands are our stress glands, and they make stress hormones. It also signals to the thyroid gland, which sits on our neck and controls baseline energy and metabolism. It controls our ovaries, our testes, so it makes sex hormones. But in the adrenals, that's where the stress response happens. So the adrenal gland sits in the back. Renal means kidney, ad is on top of, so the adrenal glands, there's one on top of each kidney, and they're small, but they can wreak a lot of havoc. So there are two parts to the gland. This middle part is called the medulla, and that's actually more of a neurologic organ. It's actually innervated by the spine, and this is where epinephrine and norepinephrine come from, and those are better known as adrenaline. So this is where your fight or flight response is generated. On the outer part of the adrenals, this makes it's called the cortex, and that makes some of the other hormones. That's the true endocrine or hormone part of that gland, and we're going to talk about both sections. So the adrenal medulla is responsible for adrenaline. So that is our fight or flight response. That's what happens when you're driving down the highway and the person in front of you suddenly slows down and you slam on the brakes and you start to sweat and your heart rate goes up and you can feel tingling going down your arms and legs, and all other stuff kind of blanks out and you just react. That's adrenaline. It's not a good place to live all the time. A lot of business owners, I've heard this because I see a lot of them as patients, and they'll call themselves adrenaline junkies, or I live on adrenaline, I thrive on adrenaline, and that only works for so long. So in addition to fight or flight, we think about its purpose is to ready our muscles for action. So the things that do that get turned up, the things that don't get turned down. So our blood pressure is going to go up, our heart rate's going to go up, the adrenaline goes to the liver, and it releases, there's these stores of sugar in the liver called glycogen, and it cuts those so that little pieces of sugar fly off into your bloodstream, so your muscles have that for fuel. Your lungs dilate, your blood vessels dilate, your pupils dilate. You're ready for action. Everything that's non-essential shuts down. So digestion, absorption of food, healing and repairing, sex drive and libido, immune system function, all of those things lower because they're not an immediate life-sustaining function. When the adrenaline turns off, or the opposite of that sympathetic or adrenaline activation, is the parasympathetic system. And this is where we rest and restore. We heal, we repair, we digest, we procreate, our heart rate goes down, our blood pressure goes down, the immune system function goes up, and we don't get enough of this right now. So that's the neurologic part of the adrenals. The outside of the adrenals, or the cortex, is the endocrine gland. And there's three layers to it. One that regulates salt and electrolytes, like sodium and potassium. The second regulates the stress hormone cortisol, which is another big problem for a lot of us. And then thirdly, it makes some of our sex steroids. Some come from the ovaries and testes, but we also make some testosterone, estrogen, and progesterone in the adrenal gland as well. So this is the part where a couple hours later you won't be allowed to leave unless you can recreate this slide. But it really just shows the pathway of hormone production in the adrenal gland. So believe it or not, we start with cholesterol. So we need cholesterol in our body to make some of our other hormones. And there's an enzyme that's activated by our thyroid hormone that actually turns cholesterol into the master hormone in the adrenals, which is called pregnenolone. No one's ever heard of this hormone, but it helps our brain, it helps our memory, our concentration, and it's the master hormone where all these other adrenal hormones come from. So when I look at this, and sometimes people will talk to me and say, well, which of my hormones is out of balance? Well, you can't say any one. I mean, they're all connected. Even thyroid is connected to this system. So you can see what's in this pathway is not important, but at the bottom is aldosterone. And that's a hormone that controls how much salt and potassium our kidneys hold on to or put out. At the bottom of this pathway is cortisol, which is a hormone that manages stress a little bit longer term than the adrenaline. And then this is a catabolic pathway, meaning it over time, if that cortisol is high for too long, it's going to break the body down. Down this other side is the anabolic pathway, things like DHEA, testosterone, the things that athletes aren't allowed to take because it builds the body up. But as we're under stress and as we age, sometimes replacing some of those can be helpful. So the effects of cortisol on the body are very similar to the effects of adrenaline. They just last a little bit longer term. So the cortisol will also increase your blood pressure and heart rate. It will also increase your blood sugar. It will actually cause the liver to make new sugar. And when the sugar goes up, you need more of the hormone insulin, which takes sugar out of the blood. And when that insulin goes up, insulin is a fat storage hormone. So the more insulin coming out in your system, the more you're going to gain weight and the more insulin the body needs. So you get into this vicious cycle, with between these two things alone. If you're always in a realm where cortisol is high, eventually you're going to develop hypertension or high blood pressure. Eventually you're going to develop diabetes. And when those things happen, you're at increased risk for heart disease. So, my goal today is to get you to change these things before you develop those diagnoses, or if you have them, they can actually be reversed. Beyond just the insulin, that high cortisol can cause sleep disturbance. So cortisol is supposed to be super high when you wake up in the morning because it kind of gets you out of bed and gets you going. Then it drops toward noon, evening, and it should be nice and low at night. If your cortisol rises at night, either because of anxiety, worry, stress, or because you were working till midnight, or if you have a condition that interferes with sleep, like sleep apnea, then you keep getting spikes of cortisol all night long, and your adrenals can't rest, you can't rest, and again, you worsen the increased blood pressure, the increased blood sugar. Immune system dysfunction can happen when cortisol is too high or too low. When it's too high, it can suppress the immune system. When it's too low, it's hard for your immune system to sustain a response. And when the immune system isn't working right, you're at increased risk of infection, things like allergies, and even cancers. Our immune system's constantly surveying the body to look for cells that are turning abnormal. And finally, not finally, but you can get disruption of how ovulation in women or sperm production in men, and it can cause thyroid dysfunction. So it sounds terrible. It sounds like, why do we have cortisol at all? And so I asked the question, are adrenaline and cortisol bad for us? And what I would say is, in the acute setting, no, this stuff can save your life. If you're in an accident, if you're, running from the saber-toothed tiger. These systems developed in our body over thousands of years to protect us from acute, life-threatening, but intermittent stressors. In the chronic phase, when I say in life in general, most people have chronic persistent stress. Whether it's the fact that, we carry around these cell phones that, people can get us at any time. Do you guys remember when there were even no answering machines, and if you called someone, you had to, just keep trying until you got them? Or they left a message and you got back to them when you could, or you sent something in the mail. Now people demand immediate responses for many things. We have traffic, we have a pressure in the United States to work all the time. We wear it as this badge of honor. Well, I worked 16 hours yesterday, I worked 15 hours yesterday. It's no badge of honor. And I would say again, this is even more so for business owners. We don't end the day at 5 or 6, and many people who aren't business owners don't either now, especially with work at home that happened during the pandemic. But always, I find myself with my husband, we're on vacation, and all of a sudden an idea comes up, and the next thing you know, we're sitting there planning out some new strategy. There's just, there's not that chance to heal and repair and restore. So, and I just remind you, the week in the life of the business owner has at least twice as many little kapow things as, the regular person. It's taking a while for it to populate, so I'll just let that happen. Just relax and let that I wanted to talk a little bit about how, well, before we get to thyroid physiology, there are stages in this adrenal dysfunction where cortisol is high. If you let that go for too long, eventually those glands burn out and cortisol is low. So, there's decades that you can intervene in this process. Now, the way cortisol affects our other hormone systems, first I want to talk about the thyroid. So just like the adrenals, it's the brain, the hypothalamus and the pituitary gland that control the thyroid gland. Thyroid helps our energy, our metabolism. When it's low, we might be sluggish, we might gain weight, we might swell and retain fluid, we might be constipated, have dry skin, or hair loss. I didn't get to my husband's thyroid in time, so. Sorry, Glenn did it first, so. In any case, the way thyroid works is there's this signal from the pituitary called the TSH, thyroid stimulating hormone. The gland sits in the neck, and it makes two hormones, T4, which is an inactive form of the hormone, and T3, which is the active form. And so when T4 is in the system, and by the way, that's what, for anyone who has thyroid issues, that's Synthroid, is the inactive T4 hormone. The body has to use an enzyme to turn that into its active form T3. But when cortisol is high, it actually blocks that conversion and the wrong enzyme gets activated and it makes something called reverse T3, which is a mirror image, or in science it's called an isomer of T3, and it blocks the thyroid from getting into cells. So you can have the symptoms of low thyroid with a completely normally functioning gland, it's just not converting properly. So that's one of the things we see other hormone balance-wise as a result. Stress and cortisol can affect ovarian hormones. Again, the hypothalamus and pituitary in the brain are sending these original signals. When cortisol is high, that tamps down that signaling. So you have decreased ovulation with each cycle, and it can lead to infertility issues. On the other side, when women ovulate, we make progesterone, which is calming and helps us with good sleep, and it helps us be less irritable. So if we're not having normal ovulatory cycles or suboptimal cycles, we have what's called estrogen dominance, where women can gain weight and be fatigued and have a lot of inflammation and weight gain. So same goes for men. That signaling system in the brain can be affected by the high cortisol levels, and it can affect the signals to the testes, both that affect sperm production as well as testosterone production. So high cortisol levels can lead to libido being lower or lower sperm counts and lead to fertility issues. And finally, in men, those blood sugar elevations that lead to the insulin resistance, there's a close relationship between insulin resistance and low testosterone. Men will gain weight. When they gain weight, there's an enzyme in the fat tissue that actually turns testosterone into estrogen. That naturally already increases as men age. But with further insulin resistance and weight gain, that process worsens. So now men have too much estrogen compared to their testosterone, and symptoms like breast growth or swelling or irritability, fatigue can be a result. And a lot of that can be initially triggered by cortisol. So why are we doing this to ourselves? I think that clearly we're not all just going to walk away from our businesses and say, well, this is too stressful, I have to look out for my health. But I think there's a way to do both, and to balance our businesses with and our stress as a result of that with health concerns. So what are we to do? So there are some things you can say no to. One of the things CG talked about was developing leaders in your organization. The more people who can think for themselves and solve problems takes pressure off the owners. I use a concept personally called the life garden, and it's not mine, I stole it. There's a guy called the Urban Monk. I don't know if anyone's ever heard of him. His name is Pedram Sojai, and he's a Buddhist monk who's originally from California, and he's a Chinese medicine doctor. But he has come up with all these little hacks of how you can use, this Buddhist monk philosophy in normal American life. And one of his concepts is the life garden, where the truth is you can only nurture about 4 or 5 things well. So it's really important to sit down and figure out what those things are, and those are the things you water and feed. And you can do that both in your personal life as well as your business life. Anything else that comes up are weeds, and you pull them and you don't nurture those. So it's a good concept to kind of try to, you can keep moving forward and keep doing your business, but you don't get distracted by the weeds. Mitigating the effects of stress. Meditation, yoga, deep breathing. There's great science that all of those things reduce stress levels and cortisol levels themselves by sometimes up to 30 to 50%. Now, the problem is they all take time, but I promise you, if you pick one, meditation, even for 10 minutes a day, you will be more efficient and you will have more time in your day. So giving up that little bit of time will help your focus for the rest of the day. Getting outside. So nature is where we grew up. It's where we developed, where we evolved, and we don't often see enough of it. The sky, the sun, the trees, the ground. The earth is an electron donor. It helps to ground us and to, it helps balance out oxidation and oxidative stress in the body. So putting your feet on the bare ground, touching a tree, all of those things can actually help put us in parasympathetic mode and reduce stress. Exercise is great. When you exercise, cortisol goes up temporarily, but over the long term, your body makes endorphins and it helps put us back into the parasympathetic mode and to be calmer. Nutrition, sugar, processed food. The guy told me cookies are coming out later. I'm not going to be watching who eats the cookies, but sugar and processed food will cause dysregulation of our cortisol response and make our stress response greater. It makes you feel calmer for 10 minutes, and then after that it can worsen stress. And then there's sleep. And this is the last point I want to leave you with. If you did none of these other things, if you just go to sleep for 7 to 9 hours a night, you will go far in helping to improve your stress response, reduce anxiety and mood symptoms, and to help the cortisol response. So I've heard many times, I grew up in the medical world, so we would brag about how many hours we were up or how many hours we were at work before we went to sleep. It's not a badge of honor, and it's not weak to sleep. I'll do a little quiz. How many of you generally sleep less than 7 hours a night? That's a lot? Okay. So for just one night of sleeping less than 7 hours, your blood sugar will otherwise be higher than it was had you slept 8 hours. Your blood pressure will be higher. Inflammation will be higher. Your immune system won't work as well. How many sleep less than 5? Still some there. Again, sleeping less than 5 hours a night in reaction time is equivalent to having a 0.05 blood alcohol level, almost the legal limit. So, and your risk of diabetes, heart disease, and immune dysfunction go up. There was one of my other, so the effect of sleep on adrenal function is that, if you don't sleep for that good hunk of time at night, your adrenal glands, your cortisol production doesn't turn off. So that's why your blood pressure's higher, your blood sugar's higher. So we need that to turn off so that gland can rest and heal. One of my other favorite authors besides Pedram Sojai is a sleep researcher. His name is Matthew Walker, and he's a PhD. He wrote a book called Why We Sleep. And he quoted a study in which about 50% of kids with attention deficit and hyperactivity disorder were sleep deprived. And when they went to sleep for 8, 9, 10 hours a night, many of their symptoms resolved without medication. There was another study done in Minnesota. Now, they have some pretty smart people in Minnesota because their average SAT scores were 605 verbal and 683 math. They switched the start time. So we have a lot of evidence in sleep about teenagers that if they can get up later, they function better during the day, and if they get an extra hour of sleep, it makes a huge difference. So they changed, over years, these were their average scores. They changed the start of school from 7:25 to 8:30 a.m. for these high schoolers, and their test scores went up to 761 and 739, doing nothing different. So, many of you may say, well, I don't have 7 hours to sleep, I don't have 9 hours to sleep. And I will promise you, if you try And if you do it, you will be more efficient and actually get more done in your day. There will be less repetition, less distraction. And that alone can help that stress response. So that is the end of my talk on how stress affects us as people, as humans, and as business owners. And I don't know, CG, do I have any time for questions?
Yes, you do.
Okay. Yes?
So, folks, is there any genetic component? Everyone sleeps differently. You know, I've known someone who went on 4 hours of sleep all the time. She was amazing. But if anyone wants to alter that, because it may, you know, what are your suggestions about helpful or herbal remedies to help?
Sure. So her question was, A, is there a genetic component to how much sleep we need? Because there are, you know, stories about people who can function on 4 hours of sleep and get lots done. And B, what are some things you can do to improve your sleep that are natural? So first of all, yes, there's maybe a half of a percentage point of the population that can actually truly be okay on 4 or 5 hours of sleep. So you may know someone like that, but the chances are it's not even one person in this room. So, you know, people may think they're doing fine, but over the years that can catch up. Secondly, I'm a big fan of sleep hygiene. I did this with my kids when they were little. I was so rigid about, like, we had to be home always by a certain time to get them to sleep. And I do the same thing with myself now. So going to bed at the same time every night, preferably before 11. If you can be asleep by 10 or 10:30, you'll have a much better chance of falling into the normal cycles of deep sleep, REM sleep, etc. Secondly, getting up at the same time, not shifting that schedule on the weekend, not sleeping in on the weekend, but always getting up at the same time. So if you go to bed at 10:30, getting up at 6:30 or 7. The third thing is the room that you're in. And, you know, to me, this is very routine. So if it's all boring to everyone, I'll just repeat it quickly. But dark room, cold room under 68 to 70 degrees, nothing in the room, no TV, no screen, no phone, no computer. Bedrooms are for sleep and sex only. Sorry, Karina. My 16-year-old daughter's sitting there. And you know, just so those are great things. Herbal-wise, melatonin helps some people, other people it doesn't. Really, the effect of it might be able to get you to sleep maybe an hour earlier or prevent you from waking up at night. Some other herbal things are things like valerian root, wild lettuce, passion flower. There's a bunch of herbs that are often found in combination in a bunch of sleep supplements. Sleep medications can make you unconscious, but often they don't improve deep sleep. So even though you're sleeping, you're not getting into the most restorative phases of sleep, and often missing dream sleep, which is where your emotions are processed and detoxed, I guess, if you want to say. Just another quick aside about sleep and timing of sleep. Did you know that the week after Spring Forward, which we did this past weekend, experiences a 6% increase in auto accidents? Consistently, year after year after year. So, you know, the Senate just passed a bill that would keep us in daylight savings time. That's not how we as humans evolved. Like we can't, you know, if they were, I agree with making it one schedule because people get messed up, especially at Spring Forward. But when you're getting up in the morning and it's dark, it messes with your circadian rhythm. So if that happens when we're in December and it's, you know, you're getting up at 7 a.m. and it's pitch black, get a light lamp, get one of those. It's just on Amazon. They might be $50, but it's a UV light and it's 10,000 lux, and you want to expose yourself to that light first thing in the morning. That actually helps your internal sleep clock match the circadian rhythm, and it will also help you fall asleep at a better time at night. So that's another great solution for some of my patients that have trouble falling asleep or wake through the night. Getting that intense light exposure first thing in the morning can actually help regulate the sleep cycle. Anything else? Yes?
I'm at a dilemma because I get 2 to 4 hours of sleep a night.
Yes?
I feel like I get a lot done during the day, like truly. But I've tried all the things you said, all the girlfriend thinks I need to be medicated, but I feel fine. I don't know what to do, but it's kind of concerning when you're going through the list of like stuff if you don't sleep. I kind of almost had a panic attack.
Oh gosh. Okay, so this guy, I don't know if you heard him, but he's worried because he can only sleep 2 to 4 hours. And he gets left on. How old are you?
27.
Yeah, it'll be harder to get things done when you're 57.
Even when I sleep, I dream about like business stuff,
Yeah.
and I can't turn my mind.
Well, we could talk about it later, but you know, there could be, you know, there are also things that I often do to help people turn off their cortisol levels. Like there are different supplements for that, or adrenaline levels, and some of the other techniques that manage stress can also help with sleep. But you could be, you know, I said there couldn't be the person that was the half of 1% in this room. It could be you. You're a half of 1%er. Yeah, I bet. I didn't mean to scare you. Anyone else?
Lauren?
Yes.
There's no doubt that there's a lot of stress right now for employees and
Yes.
employers. What are the biggest things you're seeing is like those that you can recognize a person as kind of like a 911 time to intervene?
So the biggest way to recognize that, like in your employees, that that they're kind of either not sleeping or their stress levels are getting out of control, is going to be their irritability level, their inability to focus and get something done, making more mistakes than they usually would have made, and you know, and health issues, right? Like if there's more days that they're like, I got a sore throat, like that can be an indication that that stress response system is off. Yeah?
What do you do with somebody that has to travel across multiple time zones frequently?
Yeah, that's super difficult because, you know, your circadian rhythm and daylight hours are going to be messed up. The best thing you can do is while you're traveling, try to go, like for example, if you're going across like to Europe, you need to try to go to bed at what is nighttime at Europe while you're on the plane or whatever, not nap when you get there, and take melatonin before you go to bed. So whenever you get in your new time zone, taking melatonin about an hour before you need to be asleep in that time zone, that's probably one of the best uses of melatonin. And when you take melatonin, our bodies only make about 3 milligrams. So often you'll see melatonin supplements out there that might be 10 milligrams, 5 milligrams. I usually recommend with people starting at 3 milligrams or less. So 1 milligram, 2 milligrams, because you don't want to do twice as much as your body normally makes.
So a quick takeaway from your presentation. I don't know if you offer therapy, but I think I'm going to need it. So insulin, which I obviously have too much of because I'm fat, you're telling me to get less insulin, get a divorce, and work less.
Yeah. Or you could continue to do those things and stop eating sugar and decrease processed food and sleep 8 hours a night. So like you don't have to do all these things, right? So okay, done? All right, thanks everybody.
Thanks, Al.